Hello, everybody. My name is Matt. Here's my audience, Mr. Bear. I live by myself. So, here's a question for everybody here is should America have universal free healthcare? My opinion is yes, and let me tell you all why. So, first off, 26 million Americans, myself included, don't currently have any health insurance. As we all know from living here, the healthcare system revolves around insurance, having insurance, going to a hospital so that you can, afford to have procedures and things looked at. The biggest reason people don't have health insurance is the cost. I don't have it. I just turned 26. I'm taking off my parents' plan, and I just haven't gone around to it. I love to procrastinate. But most Americans can't afford to do it. A lot of employers will cover it. My employer will cover 60% of it, but most people just plain out can't afford it. The average healthcare plan for a single American, such as myself, in 2023, last year, was $477 a month. That's more than most people's car payments. That's a significant portion of your income would go just strictly to healthcare. And that's only the average. Some people are paying more, some people are paying less. A further 43% of Americans are considered to be underinsured, meaning they don't have enough to cover most basic procedures, and they'll end up having large co-pays and their insurance not covering everything else, which is a major issue. 43%, that's almost half of all Americans. That's, 150 million about? That's significant. And the big pro to universal health care is that you get early treatment provided by the free healthcare system, and it prevents further down the road issues, ultimately saving the taxpayer money and just creating a general healthier populace. Let's say you don't have health insurance, something doesn't feel right. Well, you can't afford to go to the hospital unless it was major. So you kind of avoid doing it, and it actually creates issues further down the road. Like maybe my ankle's not right, but I keep working and walking on it, and I don't get it treated. And now, oh look, now I need surgery. It ends up costing people money. If I don't have insurance, ultimately a lot of it comes out of government funding that hospitals get for uninsured folks. So having it universal and free up front gets it checked out early. It saves everybody's money, and it helps out Americans. So it works in other countries. Most people know that the U.S. is one of the few countries. It is the only first world country that doesn't have universal health care. 90%, about 90% of the countries on Earth have 100% free universal health care. Most European countries have it. The only place you get to where they don't really all have it is Asia and Africa. Even South American countries, Brazil, all those countries, they all have free universal health care, and it works for them for the most part. The biggest country that we can really compare ourselves directly to is our neighbors up north in Canada. Canada, if you don't know, has universal health care, but they're a little different. They have universal health care, but they still have a private sector like we do in the United States with insurance companies and private for-profit hospitals. Overall, the system works pretty well in Canada, but you will hear stories that it's not the most efficient, and I believe that's because you still have this private sector. For folks who have the money and the means to have proper health insurance, private health insurance, will go to these private places and they'll get better treatment. It's like education, Public schools are okay. I'm sure most, if not all of us in this class, went to public school like I did. It works, but we knew people who went to private schools, and to be honest, they're probably a little bit smarter than us because their parents had the means to pay for that. The public stuff still works, but it might not be as 100% good as the private sector. And my third big argument with this is that no one loses with universal health care. A lot of arguments, it's the winner and the loser. No one really loses with this one. So Medicare for All, which is the bill proposed, which is Medicare for All is free health care for everybody, would increase individual taxes no more than 20%. So that seems significant right off the bat. But you have to keep in mind that 20% increase in taxes would replace the money that you're paying for your health insurance or health visits. People are already paying for that, So you have a higher tax, but you're not going to be paying down the road for to go to hospitals because it would be free and universal. It would also decrease the cost of employers' healthcare plans, which would create more money and more revenue at your business for increased wages. So if your employer isn't paying for your healthcare plan because it's free, the government, there's more money to go around in someone else's pocket, whether it's yours or your boss's. It kind of at least reduces the cost there. Universal healthcare also allows impoverished Americans to have free and easy access to medical facilities. A lot of folks who fall under the poverty line don't go to hospitals, even when there's issues. They live with it. Universal healthcare kind of gets rid of that. Hey, just walk into a hospital, they'll take care of you. Properly diagnose what's up, and take care of it for free. So you're helping out all those folks who never really had the opportunity for proper healthcare. And universal healthcare, it also gets rid of expensive ambulance rides and reduces anxiety factor that many Americans have with calling for an ambulance. Because right now, if you call for an ambulance, and I work in emergency services as well, and I'm familiar with this, ambulance rides can be a couple $1,000s just to take you to a hospital. In universal healthcare systems, you have publicly run ambulances. And depending where you live, like if some of you folks live in the city of Allentown, you have that. The ambulances don't bill you, but if you live anywhere else, like I live in Lynn Township, it's private ambulances. They'll bill you out. They'll usually bill your insurance, but if you don't have insurance, you might be stuck with $4,000 or $5,000 for a single ride. So all in all, universal healthcare, it's a great system. I believe it is. I hope you all believe it is after this speech.